This is very interesting question. It's a 20-year-old man comes to the physician because 3 days history of fever, myalgia, swelling in his left groin after recent camping trip in California. He appears acutely ill. Physical examination shows tender left inguinal lymphadenopathy and enlarged tender lymph node in right axilla that are draining bloody necrotic material. Uh, and microscopic examination of lymph node aspirate shows gram-negative cocobacilli with bipolar staining and ceftriaxone appearance. This patient condition is most likely caused by organism with which of the following reservoir? Yes, so the patient is most likely acquired this gram-negative cocobacilli from squirrels, and the organism that is associated is Yersinia pestis. And what is the condition? Condition is bubonic plague. You can clearly see this patient is having bloody necroting material, that is bubonic plague. So most commonly this organism that are seen in some kind of rats, squirrels. So how does it's transmitted to humans? So from infected rat and squirrels, flea will transmit that organism, and they will bite the humans, and it will cause the organism to come into the human body. And that's most commonly seen where there is a reservoir, many rats, squirrels. They are asking most commonly. So the most commonly Yersinia pestis is seen with very small sized animals like squirrels. Remember, not the dogs, not the bats, but very small sized. Okay. So they are asking about most commonly. It can spread via dogs, but they are asking about most common. Remember what other reservoirs are seen in deers that are most common in America? Deer reservoir or deer ticks? Anyone? The ticks that are also called deer ticks. Connecticut area, Borrelia burgdorferi, causing Lyme disease. What other This tick causes what other diseases? There are 3 diseases that are called by, and it's called Exodus tick. If anyone, Exodus tick. There are 3 diseases that are carried by this tick. Remember, one is not rickettsia. One is anaplasmosis, and another one is babesiosis. Okay, birds. Most commonly, birds are associated in USMLE. They're used with chlamydia with the C pneumonia. Okay, chlamydia with the C pneumonia. Dogs are associated with many, but in developing country, if the patient was traveling to developing country, it's seen with developing country is rabies. Bats are the most common cause of rabies in United States, not the dogs, but the bats. Actually, there are certain cases of other animals that are causing rabies in United States. Sheep, Ship, whenever you see ship in the question or anyone is that are working with the ship, this patient are highly risk of causing which disease? Yes, bacillus anthrax. But this patient is highly risk of getting echinococcus infection. Okay. Zoonotic diseases. We'll go through these zoonotic diseases which are very important. Remember, as we said, Yersinia pestis, which is responsible for bubonic plague, it's transmitted to human via fleas and has a natural reservoir in the rodents like squirrels, rat. Also, there are dogs, rabbits, but most commonly it's a squirrel and rat. It's most commonly seen in rural areas of western US. And remember, aminoglycoside is treatment of choice. We don't need to see any diagnosis, but remember there is a now treatment for the plaque, that is aminoglycoside. As we see, deer ticks are associated with two diseases. One is anaplasma and Borrelia burgdorferi, that is causing Lyme disease. The tick is Exodus tick, and which lives on deer and mice. One more disease you have to remember with Exodus tick is babesiosis. Babesiosis, which are classically seen as Maltese cross in RBC smears. Maltese cross, remember. Rabies, it is a fatal neurotropic viral disease that is transmitted from exposure of saliva to infected animals through the bite. Most commonly it's seen with bats, raccoon. Remember, raccoon are the most common in certain areas of United States like North Carolina and rural areas. Raccoons are the most common. While if someone is cave exploring, bats are the most common cause of rabies. So that causes human exposure. Certain bat teeth that are very small, needle shaped, and many bite goes unnoticed if the patient is asleep. So remember, some of the bites can go unnoticed in the rabies. Echinococcus granulosum is mostly seen with uh, dog tapeworm, that is also seen with sheep farming. Sheep is the intermediate host. So humans can acquire via injection of food or water contaminated with dog feces. It causes hydatid cyst. Remember, it causes splenomegaly and hydatid cyst. Certain other zoonotic bacteria or diseases we have to remember is Salmonella enteritis, that is seen with reptiles handling who are having turtles at their pet, and they can have certain mesenteric adenitis in the seen with the enteritis. Deep puncture wound is from the cat bite is most commonly causes Pasturella multicida. Campylobacter causes bloody diarrhea is seen with handling of puppies and livestock. As we seen birds, it causes Chlamydophila ptc or ptisiosis. It is treated with azithromycin and tetracycline. Coxiella burtonelli, that is Q fever, that is seen with inhalation of aerosol from cat and sheep amniotic fluid or drinking unpasteurized milk. Mycobacterium leprae is seen with humans. Humans, they are most commonly from Southeast Asia. So it's very rare to see Mycobacterium leprae in this United States, but most commonly if any humans are coming from Southeast Asia, they are seen with Mycobacterium. And in US, it's most commonly seen with armadillos. Deer is also causing disease, cause iseriolosis, and rabbit causes tularemia.
Thanks for watching. Please give a thumbs up and subscribe for more.